So good morning. Before we proceed with our procedure, first we need to prepare the equipment that we're gonna use. So first, I have my nasal speculum. So let's assume that this is a nasal speculum. My pen light. Since I don't have a popsicle stick, I improvised and I made my own tongue depressor. So here. And then, since I don't have a gauze, I improvise and I use a tissue paper and let's assume that this is the gauze. Okay, 4x4 gauze. So before we proceed with our procedure, so first, let's identify the client and verify the doctor's order and introduce myself. And after that, proceed with proper hand hygiene. Make sure that you disinfect your hands before touching the client, and then proceed with the procedure. Okay, so let's assume that I already verified the doctor's order. Okay, ma'am. So, ikaw po ba si Chloe Reyes?
Yes po.
So, okay, ma'am. So, I am your nurse for today. I am Nurse John. And I will be assisting you with a mouth, nose, throat, and sinus assessment for today. And this procedure po, ginagawa ito to check the credibility of those mouth, your nose, your sinus, and your throat also. Okay, ma'am? So, okay, ma'am. So, do you have any allergies po?
Wala naman.
Nagka-nose bleed ka po ba recently or today po?
Wala po.
Okay, so, sa family history niyo po ba, nagkaroon ng any kind of sakit sa ilong, sa bibig, or sa lalamunan niyo po?
Wala din.
Okay, ma'am. So, wala naman po kayong tinitake na any medication?
Wala po.
So, okay, that's good po, ma'am. So, okay, ma'am. So, bago tayo magsimula sa ating procedure, una po natin titingnan is yung mouth niyo po. So, okay, ma'am. So, I need your cooperation po. Would that be fine, ma'am, if I'm gonna touch you po?
Yes po.
Okay, so, let's proceed. So, mamaya na po. So, check the mouth, palpate, inspect, palpate, and then check for any kind of sores, if there's any, and etc. So, and also check the gums and the coloration of teeth, the tongue, if there's any, if there's any unusual about that. Okay. So, okay, ma'am. So I'm gonna ask you po, ma'am, to open your mouth. Okay. So while checking the mouth of the patient, you also check, inspect also the odor if there's any on the client, and then put it on the record also. So, okay, ma'am. Okay, say Okay. 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 Pakilabas po yung teeth natin. Okay. Okay. Say Put out your tongue. Okay, ma'am. So, I'm gonna use my tongue depressor. Okay, ma'am. Say Okay. Okay. So far, ma'am, I don't see any discoloration. On your teeth naman po, yellowish po yung color ng teeth natin. So there is a possibility po na maybe stronger po yung teeth nyo, or pwede din po sa lifestyle, sa pagkain nyo, sa mahilig kayo sa kape, it will stain your teeth. That's why po, medyo yellowish yung ngipin natin, pero hindi pa po natin alam. So, chinek ko naman po yung tongue, wala naman po problema. So, yung cheek naman po, wala naman po ako nakita any patches, wala naman pong hairy or something about your mouth. Okay, since we're done with the mouth, let's proceed to her throat. So, I'm gonna ask the patient again to open her mouth, or his mouth, so I could be able to check his throat. I can see this dangala-ngala, and then I can also check for the tonsils of the client. So, ma'am, I'm gonna ask you again po, ma'am, to open your mouth and then put out your tongue. Okay, ma'am? Okay. I'm gonna use my pen light here so I could be able to see the surrounding of his throat. Okay, done with the mouth and throat, let's proceed to the nose of the client. So, I'm just gonna ask the client to sit back, and then let me proceed with the procedure. And then, first, let's go, in checking the nose of the client. So, we're gonna need to check, inspect the external part of the nose, and palpate a little bit the external to check for any swelling, any dislocation of the cartilage of the nose of the client. So, okay ma'am, so check ko lang po yung ilong nyo. So, first, you're gonna check for any discoloration, if there's any swelling, by inspecting and palpating the nose of the client. Okay. So, wala naman po ako nakapa na any kind of swelling, and wala naman po any kind of discoloration sa external part ng nose mo. So, the next steps po, ma'am, in checking the nose, I'm gonna ask you po to close your mouth. I'm gonna ask the client to close her mouth, and then I'm gonna press one of his nose, left and right, both sides, and then I'm gonna ask him to release air on it. Okay, ma'am? So, pag na-press ko po yung isa ng ilong, magre-release po kayo ng hangin, okay? So, just close your mouth, and then I'm gonna close this. Okay. And then the other one. Okay, so, both naman po, ma'am, may lumalabas na hangin. So, wala pong sign na may pagbabara sa inyong ilong. So, let's proceed po, ma'am. So, the next procedure in checking the nose, I'm gonna ask the client to tilt his head. Okay, ma'am, tingala po tayo bagya. And then, I'm gonna use my nasal speculum. And let's assume that this is a nasal speculum. And then, so, for me to be able to check his internal part of his nose, I'm gonna ask the client to tilt a little bit so I could be able to see what's inside and then check it. Okay, now, so, tayo. Okay, ma'am, sa kabila po. So, okay, ma'am. So, wala naman po any kind of discoloration or swelling inside, and wala naman po ako nakita pangamaga or any kind or anything na magkukos ng pagbabara sa inyong ilong. Okay po, ma'am? So, so next, since we're done with his mouth, his nose, and throat, let's proceed with the facial sinuses, sa mga sinus na makikita sa mukha niya. So, I'm gonna check it, okay? Palpate a little bit, and check for if there's any swelling, kung meron bang pain na nararamdaman yung client when I press it, okay? So, let's proceed. So, ma'am, gonna ask you po just to look straight on me. And then po, gonna palpate po your sinuses, okay, ma'am? So, based on my observation po, ma'am, parang hindi naman po kita nakitaan na bahagyang pagsakit while I am pressing your facial sinuses po, ma'am. Okay, since we're done with the procedure, which is the mouth, the nose, the throat, and the facial sinuses of the client, so the next step is in this procedure is mark down what is my observation to the client, put it on his or her record, and then if there's anything I see or there's anything wrong about my my records, my observation, I'm gonna write it down and then refer it to his or her physician to make any further checkup. Okay, so after doing everything, after doing the whole procedure, so set aside, clean all the equipment that we use, and then put it back to the cabinet where I hide it, and then dispose all the things that I use, like the gloves, and then perform hand hygiene.